Hello everyone and very good morning. In March 2026, Mahatma Gandhi Central University has organized an international conference on frontier areas of chemistry, where I presented my research work based on some medicinal plants and their derived compound as anti-cancer agent. Now let's come at my topic, the cancer and its treatment from the plants. First of all of us sitting here know about the cancer. Cancer is nowadays cancer is a very common disease, and every four or fifth individual get the cancer anyhow from any reason. And first of all, we see the definition of cancer. Cancer is a group of disease involving abnormal cells growth, and it affect nearby areas, nearby tissues and cells by spreading. So, when healthy cells normally grow and divide in uncontrolled fashion, then it leads to the cancer. You can see here a flow chart of normal cell division versus cancer cell division. In normal cell division, it follows a regular pattern, but um, uh, uh, in a cancer cell division, it follows uncontrolled manner, and where a lot of cells, a lot of dead cells collected and to form a mass lesions. Now, this is the some facts of cancer. These facts are based on a Globocon report released in 2022. Most of the cancer were reported as upper digestive tract cancers, lung cancer, and breast cancer. Here you can see here in orange color, you can see here lung cancer is most prevalent among the other cancers, and followed by the breast cancer and upper digestive tract cancer. And more mortality of the cancer also a lot of in case of lung cancer, 18.65%. And now it has been estimated that up to 2050, a global burden will be very high in case of breast, prostate, and cervical cancers. Now, in India, we can say that lung cancer is most prevalent cancer in males, and breast cancer is in females, followed by mouth cancers and prostate cancer in males, and cervix and ovary cancer in the females. Now, this represent the how to get a cancer, and what are the reasons and what are the factors which causes the cancer. Cancer get from a lot of factors. One of the most important factor is the reactive oxygen species, such as hydroxyl, nitroxyl, H2O2, and others free radicals. Radiation is also most important in case of cancers. Ultraviolet and ionizing rays, X-rays causes the cancer. Mutations, some genes are also responsible for the cancers. And chemicals, obviously chemicals nowadays, chemicals are very toxic, and we are getting toxic chemicals from a lot of sources. These chemicals are hydrocarbons, like polyaromatic hydrocarbons. We get these polyhydroxy aromatic hydrocarbons from the tobacco, smoke and cooked food. Alcohols are also responsible. Nitrites, nitrosamine are very toxic to the normal cells, and heterocyclamines are obviously very toxic for the normal cells. And these heterocyclamines get from the red cooked meat, tobaccos, and others foods also. And in some cases, biological parameters are also responsible for the cancer, like viruses, bacteria, Helicobacter pylori, Salmonella, etc. They causes the cancer in some cases. And we can say that cancer is in everyday life, cancer is a very dreadful disease getting from the various types of items. Now, therapeutic options for treating the cancer. Obviously, cancer, there are so many treatment for the cancer, and you can say radiation therapy, hormone therapy, targeted therapy, stem cell therapy, surgery, immunotherapy, and photodynamic therapy. Nowadays, in recent times, photodynamic therapy and immunotherapy is most feasible for the treating of the cancer. But chemotherapy is one of the oldest and one of the important therapy for the cancer. In chemotherapy, there are two types of molecules: synthetic molecules and natural molecules. Synthetic molecules obviously have many side effects, and it often low targets, and it targets all dividing cells. Pathways sites are maybe singular. We can say that synthetic molecule target the only one pathway or two pathway, not many pathways. So high in some cases we get the toxicity from the synthetic molecules, and it causes the drug resistance also. And obviously cost is very high. In comparison to synthetic molecules, natural products are very important because they obtained from the plants and food items, and they at a time they affect a lot of pathways, not one, not a single. So generally they have low or minimum toxicity, and they have a low drug resistance, and potentially more affordable because we can get at a very low cost. Now, plant and derived compound which show the anti-cancer effect. More than till now, more than 3,000 plants across the world have been reported that have the anti-cancer properties. From these plants we get the small molecules, and which can be used as a chemotherapy for treating the cancers. From ancient times, we are getting a lot of compounds as a drug molecules. We can see here the vinca alkaloids, the colchicine, taxol, from different plants. Vinca alkaloids, they are very active molecules against the cancer. We get these molecules from the Sadabahar plant. You all know Sadabahar, a small white and pink color flowers. Now, camptothecin and irinotecan, these are also obtained from the plant. Roscovitin also obtained from the plants. Now, in recently, we observed that curcumin is a very maybe a potent lead molecules for the cancer, and it is under trial in clinical trials phase second. For the pancreatic cancer, resveratrol obtained from the grapes, berberine obtained from the berberries, and genistein obtained from the soybean plant, and some pulses also. They all molecules are in the phase 1 to 3 under trial. Now we can go at another slides. Statistical flow chart to isolate anti-cancer from plant. How we can isolate the compounds from the plant? This slide show the workflow from collection to plant to up to the preparation of extract, then the evolution of the anti-cancer activity. Now, firstly we get the plant from the marketplaces or from the botanical gardens, and anywhere in the fields. Then after processing, we get the extraction: ethanol extraction, chloroform extraction, butanol extraction, and ethyl acetate, and there are some other solvent also. We get the extract, and then after preparation of extract, by the help of chromatography, we get the compounds in purified form, and then we identified the compound with the help of HPLC, mass spectrometry, and NMR. and then after getting the purified compound, they will be subjected for the anti-cancer activity. In case of anti-cancer cancer activity, two protocols are available: in vitro and in vivo. In vitro cell lines are used, and but in vivo some animals like rats, like rabbits and monkeys are used. Now after that, if molecule is active, then it will come under the clinical trials. Now this is the plant Anthocephalus cadamba. I have worked on it, and this plant is very well known for the anemia, inflammation, blood disease and skin diseases treatment. And pharmacologically, if we talk about the pharmacological properties, it have antidiarrheal, antimicrobial, antibacterial, antidiabetic, and some others also activities. In this case, in this plant, similar to others procedure to isolate the compounds, we have isolated these compounds, and in among these compounds, 1 and 2 were the novel compounds, and we discovered these compounds first time in nature. And some others compound isolated from these plants are also alkaloids, and these alkaloids are very active in the cancer activity. You can see here 4 and 5 compounds are very active. Now this is the MTAT assay, in vitro assay for the lung cancer activity and cell viability, evolution and apoptosis. In all the compounds show good inhibition of the cancer lung cancer cell lines, H1299, but 4 and 5 were the more active against the against this lung cancer. You can see here IC50 values, 4 and 5 compound 4 and 5 show potent IC50 values, and fortunately these compounds were safe against the normal cells. You can see here the cell viability, evolution and apoptosis. These compounds show apoptosis, mean they kill all the cells in a very programmed manner, kill cancer cells in a very programmed manner, and show the apoptosis. Now after the MTT assay and apoptosis assay, we performed the docking study to elucidate the mode of action, in what way both compounds act within the binding pockets of the proteins which are involved in the cancer cells. Neuromedin, this is the proteins, this is cell signaling. Intermediate filament keratin 1, this is the signaling, cell signaling. Vimentin fragment, this is cell signaling, and they are involved in the cancer cells to spread the cancer very rapidly. So these molecules strongly bind within these binding sites and inhibit these proteins. Now second plant is the Dillenia indica, which is commonly known as the elephant apple, and this is the native, it is found as the native places of India, China and tropical Asia. This food is this plant, the fruit of this plant is mainly used by the elephant monkeys, therefore they are elephant apples. And fruit pulp is very sour and used in the Indian cuisines, and to make the curries, jams and the jellies. Fruit juice can be mixed with the honeys and used for the cough, dyspnea and indigestion properties. Now fruit have polysaccharides, butyric acid and other triterpenoids compound. They are compounds very active and can be used in the pharmacological properties, and these are the some chemical compounds isolated from the fruit of this plant. These are the structure of the compounds. First is the butyric acid, ribonazine, dilenitin, lutein 7O beta D glucoside, 8-hydroxyllutein 8O beta D glucoside. These compounds are actually the flavonoids, but compound first is the triterpenoids, and it is active molecules. Now, the most important things here is the isolation of these compounds. We optimize a new methods for the isolation of the compounds. We use in this method we use the coffee machine to for the extraction, and then after the extraction we isolate the compound with the help of column chromatography. Now, this is the list of this is a table of anti-cancer activity of these extraction and the molecules. This is the extract and different types of fractions which show a good activity of against these cell lines. This is the table showing the anti-cancer activity of the isolated molecules. Compound 2 show a good activity, IC50 value, good IC50 value. Compound 3 is also show a good IC50 values. 4 and 5 also show a good activity in case of MDA MB 321. Among them, compound betulinic acid exhibited potent growth inhibition of MDBA MB 231 A5499 and HeLa cells. We get a potent IC50 values, and you can see here a potent at the below side a potent IC50 values. Now, so another plant was the Oxalis corniculata, or Oxalis corniculata is commonly known as khatti meaty booty. Yeah, everyone, I think everyone can see here. This is the khatti meaty booty. Now, it is. This compound is has been reported to have a variety of the compounds, a variety of bioactive compounds, phenolic acid, flavonoid, steroid, and some other compounds also, including the butylene, phlobotannins, isoorientannin, orientannin, etc. And these compounds also show a lot of pharmacological properties. In right side, you can see a flow chart showing the how to isolate these compound, or how to identify these compounds from this plant. Now, this is the anti-cancer activity, in vitro anti-cancer activity of ethanol extract and whole plants, which is obtained from the whole plant. We in this study we take the whole plant and then make the made the ethanol extract, and this extract is subjected for the MDA MB231 anti-cancer activity in these cells. Now, crude extract was subjected